Hello students, myself Kallis Vijay, Assistant Professor Neuroscience Technology from School of Allied Health Science. Today topic is Cerebrovascular Accident, that means CVA. First of all, what is meant by CVA? The term cerebrovascular disease designation from the abnormality of brain resulting from the pathological process of blood vessels. A focal neurological deficit due to a vascular lesion, it usually with or without rapid onset. The CVA can be defined as this is the which brain disease occurs secondary to the pathological disorder of blood vessels, usually arteries or blood supplies. We should always remember the be fast, which is used to recognize the stroke and think fast about the first aid kits. That means fast. F means facial weakness, A means arm weakness, S means slurring of speech. Then we found out the three symptoms of the stroke, then we call to the emergency. T for time to call. Next, the types of CVA. There are two types of CVA. Major is ischemic stroke, second is hemorrhage stroke. First of all, ischemic stroke is the reduction of the blood flow due to the occlusion of the vessels caused by the ischemic stroke. Second one, hemorrhagic stroke. Rupture of the blood vessels and bleeding directly into the brain is called hemorrhagic stroke. There are two types of CVA. First of all, we are going to see the ischemic stroke. What is meant by ischemic stroke? It is caused by the mainly two variants. One occlusion, second one is embolism. Occlusion is caused 50% of the patient, embolism caused 25% of the patient. First of all, we are going to see occlusion. Occlusion means the thrombosis complete obstruction follows the formation of the clot. This process is referred to as the thrombosis. Thrombosis means blood clot in the blood vessels. Thrombosis is caused ischemic to a portion of the brain, followed the infarction may occur. It divided into two types. First one is erythromatous or also called as the thrombotic. Second category is non-erythromatous disease of blood vessel wall. First category, erythromatous is also called as the thrombotic. What is meant by thrombotic stroke? Thrombotic occurs in the relation to injury to a blood vessels which leads to the blood clot in the blood vessels, results of the thrombosis or narrowing of the blood vessels. It is the most common cause of the stroke. In different condition, in different various part of the blood vessels occur the stroke. First, in large vessel occlusion, example is carotid artery. Branches vessel are on the stenosis, example on middle cerebral artery. Perforating vessels, example smaller tertiary vessels. There is the two major vessels causes the ischemic infarct. One is occlusion in the major vessel causes the hemispheric infarct. Second, occlusion in the medium vessel causes the territorial infarct. This is the damage in the blood vessels. It's aorta artery travels to the brain. In this part there is the bleeding in the blood vessels. The second category is non-erythromatous disease of blood vessels. First one, other than the vessel damage, is called non-erythromatous disease of blood vessel wall. There is the three types. Coagulation disease, so called rheumatoid arthritis, systemic lupus erythematosus, and second was vasculitis, polyerythematosus nodules, temporal arthritis, and third miscellaneous like trauma, vasculitis. The second most causes of the ischemic stroke is embolism. Embolism is nothing but occlusion of the blood vessels. Embolism stroke is also called embolus lodges in the occlusion of cerebral artery, results in the infarct and edema of the area supplied by the vessels. It is the second most common cause of the stroke. Erythematous plaque in the intracranial or extracranial arteries are formed the aorta arch, valvular heart disease, ischemic heart disease, bacterial and non-bacterial, and endocarditis. Last one is miscellaneous, fat embolism, air embolism, or tumor emboli. Second one, what are the risk factors of the CVA? First major risk factor is hypertension and DM, and smoking and obesity is the major cause for the CVA condition. What are the minor causes? Oral consumption, race, hereditary, and hyperlipidemia, alcohol, and chronic heart disease are minor problems for the CVA condition. Ischemic modified factors, hypotension, hypoglycemia also one of the risk factors for CVA condition. What are the signs and symptoms? Signs and symptoms are vary from the person to person, but majority of the signs and symptoms is hemiplegia. Hemiplegia means single side of weakness, hemiparesis, and hemisensory loss, and monoocular blindness. Aphasia. Aphasia means difficulty in speaking. Facial weakness. Obviously in CVA there should be a facial weakness. Impaired consciousness, vertigo, ataxia, cerebellar signs, bowel bladder incontinence, apraxia, and hemianopia. Hemianopia means there is disturbance in the vision. CVA can be, for most of the condition, ischemic CVA can be reversible. It can be possible when if adequate blood flow can be restored early before the 3 hours and the ischemic cascade can be interrupted. The less brain damage and less neurological loss. There are the various investigation for the CVA condition. First major investigation obviously CT, MRI, ultrasound. And other than the neurological investigation is DSA, carotid Doppler and transcranial Doppler. Other investigation is MRA and MRV. And there is the common investigation like the axillary investigation like chest X-ray, ECG, blood glucose level, serum lipid, cholesterol, ERS and antibody test and urine analysis, blood clotting time, etc. And other investigation is endocardiogram, 24 hours cardiac monitoring, plasma electrophoresis and HIV screening. What are the treatment? There is no perfect treatment. We should prevent the subsequent cerebral infarct and prevent the further cerebrovascular event through the surgical and other interventional treatment. In CVA there are the two categories. First ischemic stroke. We go on through the ischemic stroke. Second category is hemorrhagic stroke. Hemorrhagic stroke means bleeding in the brain. What is mean by hemorrhagic stroke? Hemorrhagic stroke is the rupture of blood vessel and bleeding into the brain. Bleeding into the brain substance like parenchyma. Parenchyma means outer covering of the brain or surface of the brain. Subarachnoid space. Subarachnoid hemorrhage means it's a covering of the brain between the arachnoid and pia mater. In parenchyma hemorrhage there is a 15% of chance occurring the hemorrhagic stroke and subarachnoid is a 5% of chance present in the hemorrhagic stroke. First, what are the causes? The main and major causes hypertension and amyloid vascularitis, aneurysm. Aneurysm means it's a ballooning of arteries. Next, neoplasm, coagulation disorder like example hemophilia and anticoagulant therapy, vasculitis, drug abuse. Example, cocaine addiction and trauma. There are the 4 types of hemorrhage. In this picture, they are clearly given the what are the causes. First one, epidural hematoma. Epidural hematoma caused by the space between the skull and dura mater. The bleeding will occur between the skull and dura mater is called epidural hematoma. And second is subdural hematoma. The bleeding occurs between the dura mater and arachnoid mater. Third is subarachnoid hemorrhage. What is meant by subarachnoid hemorrhage means same. The space between the arachnoid and pia mater. Space between the arachnoid and pia mater bleeding is called the subarachnoid hemorrhage. Last one, intracranial cerebral hemorrhage. What is intracerebral hemorrhage means the bleeding present in the inside the brain. First of all, we are going to see the normal pathology of the blood vessels. The normal blood vessels comprise the 3 layers. One, tunica adventitia, tunica media, tunica intima. First, tunica adventitia is the outer layer of the blood vessels. It composed of the thick collagen fiber. Next, tunica media. Tunica media present between the adventitia and intima. Media is a smooth muscle with collagen support and elasticity tissue. And the last is the most inner layer is tunica intima. Tunica intima is a single endothelial cell. It presents inside the cell wall, and what will happen, this wall will be damaged. First of all, the first layer is the tunica intima. The tunica intima will be affected. The tunica intima is an important barrier to leakage of the blood and continues into the blood vessel wall. Following intima damage, the intimal cell, cholesterol, lipid, phospholipid, collagen and elastic fiber buildup will be from plaque-like or embolism-like structure will be formed. So, the vessel will be narrowed or stenosis or blocked, also called as the occluded. Following this and the other cause of the hemorrhagic occurs. This is the layers of the blood vessels. Outer layer is called tunica adventitia and middle layer is called the tunica media. And single epithelial, single endothelium cell is called tunica intima. Now we are going to the pathological effects. First of all, we saw what is the pathology of blood vessels. Now we are going to see pathological effects. In hypertension patient, weakened the wall of the small interparenchymal perforated vessels and the rupture usually occur in the near a vessel bifurcation. Arteriovenous malformation are suspected, especially in the younger patient. What will happen when hemorrhagic stroke will occur? First of all, the space occupying from the brain by the bleeding, the hemorrhage may be continues to expand beyond 2 hours due to the continuous bleeding within 48 hours. The blood and plasma act as surrounding the brain, causing the disruption of the blood-brain barrier, and cytotoxic edema will be occurs in the brain. the neurological damage and necrosis will be present in the brain. Necrosis means it's the rupture of the brain. So hematoma resolution occurs in the 4 to 8 weeks living the cystic activity. When the bleeding will be occur more than 4 to 8, it living a cyst-like formation in the brain. And sites, where are the sites? In hypertension patient, up to 70% of bleeding occur in the basal ganglion and thalamic region. In normal patient, there is the chances of in frontal region 50% of chance and occipital 15% of chance, temporal 21% of chance is there. Basal ganglion, thalamus, they are both combined 37% and pontine 41%, cerebellar 8%. In hemorrhage, we saw the two category, one intracerebral hemorrhage and subarachnoid hemorrhage. In intracerebral hemorrhage, what will be happen? Often a sudden onset of the symptoms that progress over minute to hours because of the ongoing bleeding in the intracerebral hemorrhage. Next, manifestation include the neurological deficit, headache, decreased level of consciousness and HNT. In bleeding present in the subarachnoid space is called subarachnoid hemorrhage. Bleeding into the cerebral space between the arachnoid and pia mater. It common caused by the rupture of the cerebral aneurysm. It's on the ballooning of artery. What are the signs and symptoms for hemorrhagic stroke? First of all, supratentorial hematoma. In bleeding present in the supratentorial, signs and symptoms will be headache, loss of conscious, hemiparesis, hemisensory loss and third nerve palsy. The bleeding present in the cerebral hematoma, headache, severe ataxia, dysarthria, nystagmus and vertigo, also vomiting. Bleeding present in the pontine region is called pontine hematoma, sudden loss of consciousness, quadriplegia and respiratory irregularities, pinpoint pupils. And other signs and symptoms is discontinuous eye movement, death often follows. What are the diagnostic method? As usual, CT, MRI, angiogram and MRV and MRA. Treatment for hemorrhagic stroke is coagulants prothrombin concentration and give the vitamin K, and majority of the case will require the neurological intervention. What are the symptoms will be seen in the right side of the brain of the stroke? First, paralysis of left side negligent, spatial defect tends to the delay or minimize the problem, rapid performance, short attention span, impulsive condition, safety problems, impaired judgment, impaired the time concepts. And what will happen? Stroke present in the left side of the brain, the paralysis of the right side and impaired speech and language, impaired right and left discrimination, slow performance and aware of the defects, depression, anxiety, impaired comprehension related to language and mathematics. Thank you for watching my video.